Hello, everyone. It's Dr. David. I'm here because I am getting a bunch of questions every single day about how do I become a registered nurse, especially those high school students that are eager to find what their passion is. I literally got about 12 messages in the last week about what are the requirements, what do they need to do once they get into college for those that universities that require an entrance exam like the TEAS test or the HESI in order to get into nursing school. So I figured that this would be a perfect live for me to do because that way I can answer everyone's questions in one setting. So I'm going to wait to see how many individuals are going to be joining us. And when I look at my phone, guys, I'm literally looking to see if I get any messages from Facebook. I just did a live there really quick to remind them of the live on YouTube. So if you are already watching, I want to see your questions in the message box. Because again, I do get a lot of these questions. What do I need? What classes do I need to take in order to get into a nursing program? What is the GPA that is required to get into the program? What background is needed? So I want to see all your questions in the comment box. I'm looking at it right now. I don't see any questions yet, so we'll just wait. I see a few people online now. And if you start hearing some noise, I'm near a window, so don't mind it. So now let's see. Now there's 4 people live. Let's see who is going to ask the first question. Maybe I should just start talking about it, and maybe that'll generate some questions. Well, there are many ways that you can get into a nursing program. The traditional way is if you are a high school student and you're interested in either getting into medicine or nursing, you know that you love science. Well, the first thing you need to do while even being in high school is there's so many programs out there that involve STEM that you can start taking college courses. For example, anatomy and physiology, that is a requirement to get into a nursing program. You need to take chemistry, you need to take sometimes organic chemistry, you need to take so many different science courses that are going to prepare you to understand the pathophysiology of a disease process. Now, when I got into a nursing program at Drexel University in Philadelphia, I went the accelerated route. So, what is that accelerated route? Well, that is a program that is designed for adults or whoever, students that already have a bachelor's degree in something else. However, the tricky part is that prior to entering that program, you have to fulfill the requirements in order to enter. So I had to take anatomy and physiology 1 and 2. I had to take the microbiology, the chemistries. So all those science courses, including even child psychology, I had to be done prior to entering the accelerated nursing program. Now, for the person that's in high school that is trying to see how they can get into a nursing program, you should start taking those science courses, especially if you're offered the opportunity to take college courses early on, because that's less that you have to take. Also, a lot of universities, if you already know that you want to become a registered nurse, the first 2 years of a 4-year university, you know you're going to be taking core courses, which include world civilization 1 and 2, English, the maths, but it's not until about 1.5 year in that you're going to have to test into the nursing program. And a lot of them will use a test called HESI, which when I was at Drexel University, when I did the accelerated program, that was my exit exam prior to taking the nursing boards, which you know is the NCLEX. So the HESI in many institutions have been moved from being a exit exam of the program in order for you to graduate. It has become an entrance exam, as well as many of you that have been investigating, you've heard of the TEAS test, the TEAS, which also tests not so much like the nursing piece or the pathophysiology piece. It's more trying to see how much knowledge you have of math, of English, of writing, of history. So it's basically just to see where you're at academically. That is not a nursing or a science specific test. So they just want to see, are you ready for this type of level of work? So they're going to give you that as an entrance exam. But again, the HESI is more specific. So depending on the program that you choose, they will have different entrance exams. Some programs will also require an interview. So if you are interested in certain universities, for example, I know one in Philadelphia, even the one that I attended, that will want to interview you just to make sure that you understand the importance of the program and how time sensitive everything is, because it moves very quickly. Okay, nursing is a little bit different than many other careers. For you to be a safe practicing nurse, which is what the NCLEX is going to test you on when you take the board exam at the end of your studies, you need to be able to critically think. So they want to make sure that the student that's going to get into these programs is able to do that or has the ability to learn how to do that. And what does that mean? Well, it means that you're not going to take a situation and just take it for what it is and not think critically. As you've researched the NCLEX, which is, again, the board exam that you have to take after you finish the nursing program, a lot of the questions that are simple, like factual or lab, that's not really going to get you anywhere in the boards. What's going to really get you to that passing mark is those critically thinking questions where they ask you a question and you have to think so much about all the different possibilities and what, as a safe practicing provider, you will give these patients, that's the choice that you would pick. So that's when it becomes a little difficult. But when you start getting those types of questions, that means that you're doing really well. So when entering certain nursing programs, they're going to maybe even, apart from giving you the entrance exam, when they interview you, they might give you scenarios. So always be ready to go in there with questions about their programs. So I always tell students, if you are interested in an institution, what better way to show your interest than actually having questions about their curriculum, about their mission statement. If you've seen my lives and if you've seen my introductory video, you know that one of the big things that made my decision a little easier when picking a doctoral program or even when I was in a master's degree was the mission of the school. I started at a school and I literally transferred 3 times until I found the perfect institution that matched my mission, that matched what I wanted to learn, that matched what my goals were. That is super important, because if you fall into a school that you don't really like, you're not going to like their curriculum. You're not going to like the teachers. You're not going to learn anything because you're so focused on everything else that you don't like. Then why waste your time? So it's very important that you choose wisely. So again, when you're in high school, there's a lot of opportunities for you to take those science courses. And if they don't transfer, it's fine. At least you have a head start as to what you expect when you're taking those science courses. I'm going to look into the Facebook to see if there's anybody that's asking any types of questions. Let me see. I don't see anybody yet. So let's see who has the first question. One of the questions that I did get was, let me see, I have them written here. What is the GPA that is required to get into a nursing program? So it's pretty broad. Honestly, I've been researching this because it depends on the university. So let me start there. If you go to like a normal, like community college type of setting, the GPA might be a little lower. So it has ranged from what I've been researching. The GPA has ranged from 2.0 to 3.5. Now, again, that means that a certain university might want a 3.4, another college might want a 2.7. So that is usually the range. Now, at the university that I went to, their minimum was a 3.2. Okay, so you have to go to the college website that you are interested in attending and seeing what their GPA requirement is. But know that it can range from 2.0, which is literally like a C, to a 3.5, okay? But most universities that have top-notch nursing programs are usually going to require more than a 3.0 GPA for you to be able to get into that program. And how can you achieve that? Well, if you go to a 4-year university, how I said before, the first year or two, you're going to be taking core courses. Then you have to test into their nursing program. If at that point you don't have the required GPA to get into that nursing program, that institution might say, you know what, I don't think that this is going to work, because they really want someone that's going to be very focused in school, and that is academically doing well, because the rigors of these programs can be very extensive. They can be very difficult. Let me see. Now, what other needs do you need? Well, you can come straight from high school, but knowing that the first couple years or the first year you're going to be taking course, or you can also get into an associate's program. If you get into an associate's program, you can become an RN, because you're going to do the 2 years, which is mostly like clinical and some classes. And then you're going to be able to take your boards, right? So once you become an RN, you can further move on to get a bachelor's later on, either right away or you can wait a year or two. I strongly recommend that you get a bachelor's as soon as possible, because as I said in my previous live, that is something that many individuals in institutions, when they're hiring you, are going to look at, because they want to become magnet. And in order for them to do so, they need to have bachelor prepared, at a minimum, nurses in their hospital setting. So that is one thing that many human resource departments are going to be looking at. And if you actually do your research now on, let's say, a hospital you're interested in, I know that here in New Jersey, where I live, 98% of the hospitals are requiring BSN as a minimum. But you can get that later on, or you can go straight into a 4-year university and get your bachelor's of science in nursing and get your take your boards, become an RN. So those are the two ways. Another program that I talked about in my last live was a diploma nurse. So that when you get a diploma, it's not that you have an associate's degree in nursing or a bachelor's degree in nursing. It's basically a diploma that you can practice it once you take your boards and you're an RN, but it's not an associate in nursing. It's usually an associate in applied science, so that school has an affiliation with like a community college, but it does not give you the associates in nursing. It's like on health science or something like that, applied science, that they do it. But those programs are diminishing. Right in my area, I believe there's like one. In Philadelphia, I believe there's one. They're not really existing as much anymore, because, how I said before, hospitals, healthcare facilities do encourage you to have at a minimum BSN, and some actually require it. So those programs are kind of dwindling down. But that was another way that you can also become an RN. Okay, so again, you can get the diploma if that's something that is available in your state, or you can go and get an associate, take your boards. You're in any which route you take, you're going to have to take an NCLEX exam. There's no way around it. That is the only way you're going to be able to say that you are a registered nurse. For you to get that RN, you need to pass the NCLEX. If you get a diploma, or if you go into an associate's program, or if you go into a bachelor's program, it doesn't matter. You are going to take that NCLEX exam. So that's the only way you can say I'm an RN. I do see some individuals online that say, oh, I'm an RN, and they still haven't taken the NCLEX. Don't do that, because that's false advertising. And I also believe in jinx. So if you haven't taken your boards and you're already calling yourself an RN, I don't know, I'm very superstitious, and I think that will mess your luck up. So, and I've seen that happen a lot. So that's why I kind of believe it. So again, you only call yourself an RN once you have that pass in your NCLEX exam. And your NCLEX exam is going to test you on how safe of a practicing nurse or provider you are. It's not about how much you know in a textbook, okay? So I know that there's a lot of textbook smart students, but unfortunately, the boards, that's not what they're testing. They're testing on your safety. They're testing to see if you have a patient and you're taking care of them, if under your care, they are safe, or if you're going to put them at risk for a negative patient outcome. And if you are one of my students, you know that I use that phrase a lot, negative patient outcome, because that's basically what you're trying to avoid. So, and why did I mention the textbook smart? Well, because I do have students that say, you know, I do so well in the classes. I did so well in the classes. I learned everything in the book. But when I went in there and I took my exit exam, or I took my boards, the NCLEX, I failed. It stopped at 75 questions, or I just recently got a student tell me it stopped at 60, but they failed. Well, again, it's because it's not a test that's testing how book smart you are. You have to know the information. Yes, but you also have to learn how to apply it, how to critically think the situations, right? So the textbooks are going to show you, they're going to teach you the information. Your instructors are going to teach you information. People like me, nurse educators, are going to teach you the information and help you understand how important they are in order for you to be a safe practicing nurse and to prevent a negative patient outcome. However, you have to also critically think the patient scenarios that are given to you in these exams. And that's not something that we can do for you. We can teach you everything, but you need to be able to understand by retaining the information that we teach you and that you take in from your books, and stop memorizing the information. And that's where a lot of students fail, where they just go and review information to memorize. And guess what? After they take the task, like in the class, they forget everything. It's like it comes in through one ear and comes out through the next because they didn't retain it. And that means they didn't understand it. So that doesn't work in the boards. Now, in the boards, it does work for you to memorize the lab values, which are basically factual things, but it's not going to help you when you have those select all the apply questions that everyone loves, right? No one likes them. And one of my students that took the boards, I believe it was last Monday, I think, said that they must have had like 13 select all the apply questions. And the NCLEX, the computer shut off at 60 questions because, as you know, right now with the COVID-19, the minimum amount of questions that you can get is 60 as opposed to the normal 75 questions that you would get in a normal non-pandemic world. And the maximum, I believe, is 150, which is different than the 260 something that you would get in a non-pandemic world. So that computer shut off at 60. They got 13 out of those 60 select all the apply. I mean, that is a lot of select all the apply. Actually, that's probably one of the most I've seen recently. And I'm not sure if it has to do with the fact that they've decreased the amount of questions, but still the level of intensity did not change. And the way that they grade the NCLEX did not change. It's just that they removed those questions that don't count because they're considered test questions. And they figured out from research that they had to do in order to prepare for this pandemic. They took data from the last year prior, from COVID-19, and they saw that that was the perfect amount of questions during this time to condense the boards that will give you the same level, like the same grade that the other original NCLEX would give, which is going to go back to its normal. See, like it's going to go to 75 and to 65 after September 30th. I think that's the date that I saw the last time I looked. So if you're going to be taking the boards from now to mid-September, expect it to be 60 and 150 as opposed to 75 and 260 something. All right, so does anyone have any questions? So just to review, you can go straight from high school into a university and join their nursing program, usually midway through, or you can go from high school to an associate's program that's going to give you an associate's in nursing, or if your city still offers or your state still offers diploma programs, you can join them, but know that you're not going to be getting an associate's in nursing. You're going to be getting an associate's in like health sciences or applied sciences from a collaborating college that has you as like a partner, like the program that you choose that gives you a diploma. But again, that's not really existing as much anymore. And then you do have in certain universities an entrance exam that can be the TEAS test or the HESI. And some of them, actually a lot of them, have an exit exam, and they incorporate ATI into these exit exams. And actually they're incorporating ATI, which is like a simulation type of program. And I mean, it has really good content. Into their entire curriculum, especially now that we're in the virtual learning setting, because we can't be in the hospitals yet. Although some students are going in, especially those that are taking critical care right now. So, but the others that are just starting, instead of them going into their Med-Surg 1 clinical setting in the hospital, we're still doing it virtually. So it has helped them. The ATI does provide good simulation exercises as well as questions. Sometimes I don't agree with some of the answers that they give, but then as with students, we work out the scenario and figure out what the problem was. But they also use ATI as an exit exam. So you need to start getting familiar with these things. And you can find a lot of information online on the TEAS test. There's books on it you can buy on in Amazon. There's also HESI. If your institution is going to be taking the HESI, giving you the HESI exam, you can also find those types of books. One thing that I recommend students that are interested in becoming a registered nurse is get a book on it. Get a book on, let's say, if you were going to get a Kaplan book, which is a review course that you would usually get when you're preparing for the boards, get some type of like nursing book, like Saunders as well. So it's Kaplan, Saunders, and start reading it and see if what you're reading interests you. Because this is not for everyone. I mean, I know that there is a big interest now, and a lot of people want to become a registered nurse or an RN, especially with this coronavirus, that all of a sudden we've become heroes when we're doing literally the same thing that we've been doing for years. It's just that now they super need us, and somehow they've seen that now we are, I guess, important, and they're calling us heroes. But in reality, we're not doing anything different. Actually, we're doing way more preparing in order for caring for patients, but we are treating patients just like we've always have. So if anything, we've always been heroes, but now we're super needed. So now, they trying to give us a title. So there has been a lot of interest in getting into this field. So I strongly recommend that if you can shadow someone that is a nurse that and their institution lets you, and a lot of them will, I would suggest you do that. Probably not right now. They're not letting a lot of people coming in. I mean, they're not even letting students going into the hospital setting yet. So I don't think they'll let someone shadow. But when you can, I will definitely use that as an experience. Shadowing a nurse is always good because you can see what really happens. Get a book, buy a Saunders book or a Kaplan book, and start reading disease processes and see, oh my God, does this interest me? Is science it for me? Because remember, if you've been seeing my lives, and again, if you saw my introductory video, you know that I was not always in this. I was in business before. So my brain was totally different. So when I started this program at Drexel University in Philly, my mind was crazy. Like, it was going crazy because I was not scientific at all. And honestly, I didn't, although I took all the prerequisites and I loved all of them, I did really well in the anatomy and physiology and all that stuff. Still, nursing is so different that when I was actually in the classes, I thought I was going to fail because I did not understand anything that they were saying. Even if I did, I had a 4.0 in all the prereqs that I took. But it took a while. It took a few semesters. And remember, I went to an accelerated 11-month bachelor's program. Okay. So I didn't have time to figure this out. But eventually I had to, or I was going to fail because I was not science-based. So I strongly recommend you getting a book that is a nursing book, or again, a Saunders or Kaplan that talks about the cardiovascular system, neuro, GI, GU, and all that, and see if that's something that interests you. Because you might read that stuff and you're like, oh God, I don't want to read this, or you get bored. And if that's you, then maybe nursing is not for you. Okay. But if you can get into shadowing someone in the hospital setting, I would definitely do that and see, can you see blood? Can you deal with blood constantly? Are you able to clean wounds? Are you able to see a patient having a skin graft? I mean, I had a student witness this, and she literally fainted on the floor. She became so pale. Thank God that the person that was right next to her caught that and was able to catch her before she fell on the floor, because she could not resist. Hi, Super Nurse Nightingale. She could not see the skin graft happening because they have to literally shave the skin from wherever they're getting that graft. So she could not handle that, and she literally quit after that. Okay, she could not. She said, if I can't see this, I mean, she was so sick that she left the program. And you know what? I'm proud that she did that because she realized early on that that wasn't for her, and she was able to go to some other career that might have interested her. I have students that get skeeved out of, when I'm showing them how I put an IV in for a patient. They're just, you could see their face, they become pale. They're like going in a corner, when usually when students really love this stuff, they're right there looking at you. They actually want to do it, but we can't let them do the IV sites, but they want to be involved. So when you have those students that are really like, oh my God, this is no, this is not what I signed up for. Or when you have those pressure ulcers, those stage 4s that you could literally put your head in their wound, that's how big and deep those wounds are. Forget it. I had one student one time starting throwing up. She developed a migraine. I had to literally stop what I was doing to comfort her. So that didn't work out. So that's why I say it's so important for you to, if you can get a shadow experience with a nurse, to go for it, because that's when you really know. And if you can get a couple of days in, that's even better. Make sure it's a med surg floor, like a telemetry unit, that you can see wounds, you can see trach care. Particularly me, I do not like doing trach care. However, it doesn't gross me out, or I have to do it, or else the patient's not going to be able to breathe. But some students, they cannot. Some people can't see that, and it's fine. At least you realize it at that moment, instead of spending 3 years or 4 years or 2 years in a program and then realizing that's not what you want to do. And a lot of students make that mistake, even for other careers. For example, I have students that went into physical therapy. Literally, I had one whole clinical group, except for one student, that came from the same physical therapy program. They all graduated from the same university, and they finished physical therapy, and right after they finished it, the program, the 4-year university. So you're talking about, they had 4 years of tuition paid. They did their prerequisites that they needed to get into the accelerated 11-month bachelor's nursing program that I went to, because they hated it. Okay. So, and that's similar to what happened to me in business, right? I went into business. I did it for 5 years. Around 3 years in, I was like, oh my God, I don't even want to go to work. I was just sick of it. And I started taking prereqs, and then I changed careers. So you don't want to be that person. So Miss Cass says, I agree. Most college students change their major at least 3 times. They definitely do. From all the students, and I teach many students a year. I would say I go through probably 150 students a year, if not more. A lot of them have changed. A lot of them actually start, let's say, in social work. They finish it and they go and change. I mean, I don't understand how that can happen. Like, you just paid 4 years of university, probably like $45,000 a year, have that huge debt, and now you're going to get into another one. But if you don't like it, you're going to have to do it, because the worst thing is to work in a field that you don't like. Super Nurse Nightingale says, I was a candy striper. Oh my God, I've never seen one, but I remember I used to watch Saved by the Bell a lot, so I know that's where I've seen the candy striper comment. In junior high, I got a lot of experience. And you do. And I believe a candy striper is the equivalent of a CNA, right? A nursing assistant. Let me know if I'm correct. Ashley Carter says, I have a BS in hospitality management. Now I'm going back to become an RN. So you see, so I want to know, Ashley, when did you decide that having a BS in hospitality management was not the thing for you? Like, how long did you wait to get into a nursing program? And did you have to take an entrance exam to get into the program? Let me see. And I'm going to write here what are some exams that people have been wanting to take. You have that one. You also have the HESI exam. And ATI has exit exams as well. But the most common one is that TEAS, which is just testing how much you know regarding social studies, English, writing, math, and science. All right, so let me see. I had a student once that they went through social work, social work. Then they tried to do like special education, like some type of teaching, and then ended up becoming an RN, and they did an accelerated program, passed their boards the first try, minimum amount of questions, and did excellent. And she's been doing that for like 3 years. As she said, I have to take the TEAS. When do you have to take it? And let me tell you, a lot of people freak out about this test. I don't know why you guys freak out about it. It is, I'm going to compare it to, let me see. So think about like when you were in high school and you had your social studies class and your English class and your math class and your science class. And then they give you that last exam. Okay. So from all those bits and pieces, you're going to get a state exam, right? Like that's how I did when I was in high school. They gave like a regents or something. So it was like the state exam that included everything. That's what the TEAS is. And yes, I understand that you might be nervous about it, but there are so many books that there are out there that will help you. And you have a minimum score. So it's not like they say you have to score a 99 or a 95. But you need to go in there knowing that it's just trying to see what you know, because a lot of these programs will also offer you additional assistance and additional support. So let's say if you go into a nursing program and you're not too good in science, because you need a lot of science for you to be able to be successful and for you to be able to critically think these patient scenarios. And then they don't give you an entrance exam like the TEAS test, you're going to literally fail. So they're just trying to see how they can support you, how they can help you. They might even say, well, you scored this in the TEAS exam. How about you take this class prior to joining the nursing program so that you can prepare you? Because you think that they don't want nurses? Oh my God, that is the number one. I'm telling you, if the best career choice is an RN, you will always have a job. You can move anywhere and you will always have a job. Okay. I always tell my husband this, I can, if I want to move to Florida, to Miami Beach, or if I want to move to Hawaii, or if I want to move to Puerto Rico, it's fine because I can work anywhere. So that is the job that's always going to have a job. And look at now with the pandemic, it's like number one person they need, right? Super Nurse Nightingale says, it's a volunteer. They shadow nurses, fill water pitchers, delivery and read mail, bring flowers, make beds. Okay, so that's so it's different than a CNA then, but you still are able to see what they do. So that's good. And Super Nurse Nightingale says, if you prepare, you will be fine. Exactly. That's all you need to do. You can get a TEAS book. They have a ton of them in Amazon. I'm a member of a bunch of groups on Facebook, and there's one specifically that is actually called TEAS something. And they put so many things in there. Like they upload example pages of like content that's in the exam. They actually even help each other when they have questions when they're practicing. So that might be a good group for you to find in Facebook, because there are a lot of students that are trying to get into nursing, but a lot of programs do require that, and they're super nervous about it. Like if I were to take that TEAS exam right now, I'll be like, oh my God, I'm going to have to prepare, because it's like pulling questions from when you were in high school. Like, I don't remember that stuff. So I would have to prepare for it. But once you prepare, then you're fine. Super Nurse Nightingale says, Khan Academy, YouTube, Google free TEAS practice test. Khan Academy is a super great resource. You can find a lot of stuff on there. Yeah, you can use YouTube as another resource. Just make sure that you pick the someone that is actually, somebody that can provide content that's understandable and that don't make you even more confused. Google does have free TEAS practice tests, but be careful too, because sometimes what I've noticed when I've tried to help some other people, because I'm like, let me see if I can find some free stuff. Sometimes it gives you the wrong answers. So maybe the question itself is not well written, and then you get a different answer than what the answer is, and then it kind of messes you up in the head, because you think to yourself, okay, I thought I knew this, but then the answer says that I'm wrong. So just be careful with the Google ones, but you can find a TEAS prepared book in Amazon, and I'm gonna see which one that they were trying to use before. Let me see, I'm gonna tell you right now. that I had actually put in my cart, review book, for one student when I was looking at something for them, because they just were all over the place. They were trying to look into Google and they were getting all these wrong answers. So there's one, actually, ATI has a TEAS review manual. So it's called, I'm writing it here for you, ATI TEAS review manual. And it says here 6th edition, and it has pretty good reviews. It has like over 500 reviews. So this one is a 6th edition. I'm not sure if they have a different edition so far since the last time I looked at this. There's also the ATI, let me see who puts it. Yeah, I was just gonna say that, Super Nurse Nightingale. The ATI has their own TEAS testings. That if you go to the ATI site, you can find a review book there, which is actually what I'm seeing right now. It does have good reviews too, but just to let you know that it doesn't have as many reviews as the first one that I put from, that is called ATI TEAS. ATI has a different one that's called Exam Prep Manual, and that has a little bit of less review than the other one. Oh, Super Nurse Nightingale says they have a package. One book that seems to be super popular in Amazon, it's even a bestseller, is called ATI TEAS Secret Study Guide, Complete Study Manual, and it has full-length practice exams. It has almost 6,000 reviews, guys, and it's like almost 5 stars, and it's super affordable. I think it's like $21. The other ones are a little bit more, but I mean, when it has almost 6,000 reviews, almost 5 stars, that might be one to look at. But remember that not every school requires this type of exam. Super Nurse Nightingale says the package gives you 2 practice tests. Okay, and in those practice tests, you're going to see, again, things that are from like high school, formulas you thought you never want to see again, you will see again. And that's what basically it is. So when you're taking these practice exams and when you're reviewing for this test, the TEAS, get a paper, get some or index cards, and start writing out some of the formulas that you're most commonly seeing, because that's what you're going to keep seeing, especially when you take the actual test. Because remember, it's all about what you know. So they want to see, what did you learn back in high school? Like some people haven't been in high school for 25 years. So that's why it becomes a little bit more difficult. But not every school requires this exam, the TEAS. A lot of them will require you to take a HESI as an entrance exam, especially if you are in a university where you are taking your course and then you have to test in and interview into their nursing program. For example, Rutgers University, you'll start in their like the actual college program, university like anyone else, and it's not until a couple years in that you have to be admitted into the nursing program through an entrance exam, which is the HESI, and an interview, and depending on your GPA, you will get accepted. So it's important that you know that, because a lot of students will try to apply to these universities that eventually will lead into the nursing program at that same university and not make it in. I've had so many students that have had that issue. And it has to do with their GPA, their academic performance, and their ability to pass that entrance exam. So know that just because you're into a university and you know your major and you know that you want to be a nurse, doesn't mean you're going to end up in that program. So sometimes it's even better to go into it like an associates of nursing first, because you know automatically you are in the program, and then getting a bachelor's. Like if you think about it that way, then getting into a 4-year university that it actually requires midway through for you to get admitted into their nursing program, if you do. So that way you're kind of not in limbo, because how about if you don't? Now, how long have to wait? Do you have to transfer to another school, or what the deal is? So sometimes maybe it's even better to go to a 2-year and take your NCLEX, and then continue with your bachelor's. Once you start working, have your employer pay for it, because they do have tuition reimbursement. All right, so let me make sure I got any questions here. Oh, I forgot. So Ms. Cass says, so if they know for sure that they want to be a nurse, they should be preparing 10th and 11th grade, in 10th and 11th grade. Yeah, so if you know, right, if you know, I have so many students that also said, like when I'm teaching the, not the accelerated programs, the traditional, that's what they're called, that said that, you know, I've always wanted to be a nurse. My mom is a nurse. My grandfather's a nurse, was a nurse. My grandmother was a nurse. My aunt is, my whole family's a nurse. And I know I want to be a nurse. So what you do when you're in high school, you start taking some courses, okay? So there's a lot of choices. Many high schools have collaborations with local colleges, okay? I know my son's school does, and he's been taking college courses for what he wants. So there are many schools that have those collaborations, or even the school themselves will offer these courses, like the anatomy and physiology, the chemistry. So if you know that you're going to be have an interest in becoming a nurse, and the first thing I would do is actually print out a course list from a college, a nearby college that you know of. Or if you are adamant about going to XYZ University, print out the curriculum for that program itself. And then, and then you can say, okay, well, they want this, that, and the other thing. Well, guess what? Does my high school offer that? I'm not saying that they're going to offer every single course, but at least you have a head start. So if they are saying we're going to require anatomy and physiology 1 and 2, which just telling you is a requirement, and my high school is offering anatomy and physiology 1 and 2, well, take it. Because a lot of times, especially if you have that college affiliation, and let's say you're taking advanced placement courses, you won't have to take it again once you go to the university. Or if they don't take it, you still have a head start because you have learned the information, okay? The same goes for chemistry. I mean, when I was taking chemistry, I hated the class, but eventually, you know, things started making sense and I started liking it. But, you know, when you hear chemistry and when you're looking at this content, you're like, oh my God, what is this? But at least you have a head start when you are going into college setting. Sorry, that's my dog that he thinks is the alarm. Every time he hears a noise, he starts barking. So the important thing is to be able to see what you're getting into. And guess what? If you notice that you took anatomy and physiology 1 and 2 in high school, and you don't like the class, and you say, wait, hold on, that's not for me, maybe that's going to make your decision easier. Do I really want to be a nurse? I mean, you're going to deal with anatomy and physiology your entire nursing career that starts as a nursing student all the way through your entire registered nurse life. That is going to be part of your daily routine. You need to know pathophysiology. You need to know how the systems in your body work and how they work together. You need to know pharmacology and how pharmacology connects with pathophysiology. So if you can have a head start on that in high school, and you can take those courses before entering the university setting, and then imagine you're going into college with a head start. And you're like, oh yeah, I saw this in high school. This is a piece of cake. Guess what? Guess who's going to get an A? You are, because you came prepared. So if you are able to take these courses that are science specific, you know, nursing courses you'll take once you're in the program, when you're in high school, it's definitely going to be really good. And actually, a lot of community colleges also offer like non-credit courses, but you have to pay out of pocket. Just in case your high school does not provide these types of science courses like anatomy and physiology 1 and 2, that you can actually pay it on your own. And it's super more affordable than when you get to the university rates. Because as you know, you're paying like half an eyeball per credit when you are a college student. So that was a good question. So let me see if I missed any other questions. Let's see here. Does anyone else have any other questions regarding anything that's required to get into a nursing program? Let me check the Facebook to see if anybody has a question there. Let's see. So many notifications. It's like I can get lost in all these notifications. I don't see any questions so far. Now, one of the things that I show my students is, I'm going to see if I can pull it up. Let's see if you could see it. So that's a pulmonary embolus. So I showed my students that, and one of them was disgusted. I find it fascinating. I'm going to put it again. Let's see. I think you can have a good visual. You see, I could look at that all day when they're taking that clot out of that vessel. But some people can't look at that. So if you can't look at that, you have to really think about what you want to do, because maybe this field is not it. Okay, when I look at that, I find that fascinating. Honestly, like I could look at that all day long, and it has so many views. It has literally, I put it on my Facebook page that's called Margarita, aka Dr. Registered Nurse, and it has almost 90,000 views. So I know that there's some people that are just watching it all day long. Another place that you can also see if you like to do any of these things is if you watch Dr. Pimple Popper. I love Dr. Pimple Popper. Like my daughter and I can watch it all day. So if you enjoy that stuff, then nursing should be a piece of cake. So Dr. Pimple Popper, like look at that stuff. And if you start throwing up and you're like, oh my God, I can't watch that. Imagine how you're going to get when you're trying to do a wound change. How I said before, a stage 4 pressure ulcer in the sacrum, like around their butt cheeks. That I had a patient one time that I could literally fit my whole head in his butt cheeks. That's how big of a pressure ulcer here. It was like this. I could go like that, just like that. Okay. Or I could put my whole fist in there. Okay. So if you can't see someone popping pimples, what makes you think you're going to be able to do a wound dressing change? So let me see. I think I had a question. Let's see. Okay. So yeah, it's about the pressure ulcer. Another way that you can also test yourself is you can shadow a phlebotomist, because part of a registered nurse job is to do lab draws when needed, especially in emergency, especially if you have a PICC line. So if you can shadow a phlebotomist, that'll be good too. But definitely Dr. Pimple Popper, go online and watch all those gross videos of different types of procedures and see if that's something you like. The only thing that grossed me out in the beginning was trach care, and I got over that really quick. I got a system to do it because I did get grossed out in the beginning, but that was it. It didn't happen again. But I do recommend you watching all those videos, those gross videos online, and see if you get grossed out, or if you start throwing up, or you want to faint. Because if you don't like the sight of blood, I'm telling you right now, you're going to be dealing with blood on a daily basis. Okay. So that is the number one thing. You cannot have a fear of blood if you're going to become an RN, because you're going to see that a lot, especially when you're dealing with somebody that comes in with a GI bleed, or maybe due to alcoholism, has esophageal varices. Those are varices, vessels that are right here around your throat, and they burst, and then the patient is bleeding like it was a hemorrhage. Like you'll never forget that patient, the GI bleed. Not only the smell of the blood, but also there's blood everywhere on the walls, on the floors, everything. That's what the one patient I had with that. So you need to be able to be comfortable with blood. All right, so does anyone have any other questions before we are done? So remember, if your high school provides these science courses, take them if you have an interest in becoming a nurse. If they don't provide them, you can always get them outside of your high school in like a community college, and it's pretty affordable. Usually it's super cheap. And a lot of times your high school will have a collaboration with a college where you can even pay like my son, one of the courses he takes at the college, he pays, not at the college, at the school that's counted towards college credits, is like $150, which compared to the tuition of a university is basically a gift. But again, you can take it on your own. Make sure that you're comfortable with blood and all these types of procedures, because that's something you're going to see a lot of. To prepare for your entrance exams, get review books, especially for the TEAS test, which is going to test you on how much you already know, and is usually information that you learned in high school. Okay. And you can easily prepare for it, especially the math part, which is like those formulas that you thought that you never wanted to see again, and then you're going to have to see it again. If you're taking the HESI as well, for your exit exams, when you're already done the nursing schooling, however years you took, if you did an accelerated version, or if you took the 4 years, or you got an associate's degree in nursing, know that at the end you will have an exit exam. In most universities they do, and the required exam, which every single soon to be RN will have to take before they call themselves an RN, is your NCLEX, which is the dreaded final exam that many dread. I dreaded it. I mean, when I took it, I had the 75 questions. Was a long time ago, so that was pre-pandemic, so it was a 75 questions up to 265. I finished in 50 minutes, and I only had to take 75. The thing turned off. I thought my life was over. I went home. My husband took, at that time we only had the boys, the two boys, they went to New York. I was literally eating ice cream and chips and looking through a Saunders book for Saturday and Sunday, because I made the mistake of taking the test on a Friday. Never do that. I wouldn't even take it on a Thursday. I would take it Monday, Tuesday, Wednesday, because remember, you will not have your test. Oh my God. Super Nurse Nightingale said, I took it before the computer. So that's when they used to give it in paper format, and sometimes it would be like a multi-day thing. I would probably go crazy. So I thought I failed the test, literally failed. I didn't get my results, I think, until Tuesday, and I couldn't even see it. I had my husband log in for me. And I was hoping he didn't play around and say, oh, you failed, because I think I was going to have like a nervous breakdown, but I passed. So when you have that feeling that you failed, more than likely you passed. And never go back home and look up questions. You'll never remember what the question asked you. You never remember half the answers that they gave you, half the choices. So don't waste your time, because then you're going to say, oh, I really did fail. And it's just because you didn't remember what you got. Super Nurse Nightingale says 3 months to get the results. I would, oh my God, no. Yeah, I don't remember when they started doing the computer, but I do know that it was sometime in 2000 or even late 90s. So to wait 3 months for those results, I would have, oh my God, I couldn't even do that. That's a long time. And imagine if you failed, you had to literally take it again and wait another 3 months. Okay. So, and talking about failing, if you were to fail the NCLEX now, or, since it's been given computerized, you are able to retest once you get the new number. And they usually do it like within a few weeks. If you fail again, okay, it's going to take a little longer. So basically, if you fail 3 times, you have to take a refresher course. Okay. And it's usually like a 3-month refresher course before you take it again. So it's always best to just go in there prepared the first time. And if you do fail the first time, now you know how the test is. So you now have an advantage. And then when you go the second time, although you will never have the same questions, because remember, these questions are catered to how you answer the previous question. And it's like a 0% chance that you'll have the same questions. I'm part of the NCLEX question panel. So I'm telling you right now, you will never, ever have the same questions ever, as many times as you take it. I knew 2 people that took it for 7 years, and they took it 7 times, and there was no way that, and they actually gave up. And thankfully I met with them. We did a test taking strategy session for both. And the one, she passed when she took it. And then the other one took a little longer, but then she passed after 7 years. So that was good. Super Nurse Nightingale says tests were only given twice a year back then too. Oh my, so I definitely probably would change careers at that point if I knew, or I would have never picked it if I knew that was the issue, because I didn't even want to wait a weekend. Now waiting 3 months and then only be able to take it twice a year, that's too much for me. All right. So does anyone have any other questions before we wrap it up? Now, I want you to tell me, I'm trying to do these lives every other Monday. So, okay, hold on. Miss Cass says the younger people are like, what are these ancient people talking about? Yeah, I wasn't part of that, but they did do it paper and pencil. And it was usually, from what I've heard from my older friends, they were like in a conference style type of room, and they had a bubble in stuff. And I don't know. When they told me about it, I said, and then some of them said that it took them 2 or 3 days to complete that test. I was there for 50 minutes, the 75 questions. That computer shut down. I was out of there. But I felt like I failed, but I didn't. But you know, when it's something like that, it doesn't even give you a warning, like I'm shutting off. No, you answer a question, poof, blank screen. Now remember, you can get a different amount of questions. Like when I took it, a 75 minimum, 265 max. So it finished at 75 questions, but at any point from 75 to 200 and something, that computer can just shut down on you. Because at that point, it determines if you were a safe practicing nurse or not. So what does that mean? That it said if you are a safe practicing nurse when it's shut off because you've passed, means that they determined that those were the amount of questions that they needed to see if you were safe to practice as a registered nurse. If the test stopped and you failed, that means that it doesn't matter how many more questions they give you, you are not going to show that you are a safe practicing nurse. And that's hard to tell some students because they are so focused on 75 questions or this types of questions or that question, and how about if it stops at 76 questions? So that means this. And I say the same response. I say if the test stopped and you passed, it's because at that point they said, okay, this person is a safe practicing nurse, or the opposite, they're not. So if the test stopped at 75 questions and you passed, again, you are considered, they don't need to give you the rest of the questions to determine that you are a safe practicing nurse. The same goes for the 60 questions. Now, because we're in a pandemic, they have to condense and due to social distancing rules until September 30th. If that's when it stopped, again, that is when they determine that it doesn't matter if they give you a million more questions, you are a safe practicing nurse. But it can go the other way. If it stopped at the 60 questions and you failed, that means that it doesn't matter how many more questions they give you, you are not a safe practicing nurse and you have to retake this exam. It is what it is. So it's hard to explain it to students. So I kind of just explain it that way, which is simpler. Because, sometimes they might get offended. Oh, well, what is that saying, that I don't know anything or that I'm dumb? No, it's just saying that you are right now, your knowledge and your critical thinking level is not safe to practice as a nurse. So there's no other way of saying it, but just saying how the meaning is. Super Nurse Nightingale said 1 day for LPN, 2 days for RN. Okay. Oh, okay. Got it. Erica Ewell, hopefully I said your last name right, or Ewell. Last month, the question shut down at 65 questions. So did you pass? Because it shut down at 65 for her because now during the pandemic, the minimum is 60, maximum, I believe, is 150. So it can shut off at any point during that interim, as well as when it was regular, how I said before. Good. Congratulations that you passed. And put here, congrats. I know that you're happy that's over with. No, that's one test that, although some have to take multiple times, is one test that you want to prepare so good for that you don't want to take ever again. I never want to see that test ever again. I mean, how I said, I'm part of the NCLEX question panel, and I will have to see them when doing questions for the boards for the NCLEX. However, for me to take that test again, I'm thankful that they don't have like a renewal NCLEX or something every certain amount of years, because I will probably go crazy. Let's see. You're welcome. Let's see what else. Anybody else have questions? Maybe I missed something. See. All right. So if no one else has any questions, how I was saying before, I'm going to be doing these lives every other Monday at 8 p.m. That's kind of the time that I send out like a little survey in our YouTube channel. And that was like the consensus, as well as my Facebook, because 7 p.m. sometimes a little too early, depending on the time zone. So 8 became like the time. So I want you to tell me, you can either put it in this post, because I leave these live chats open so I can keep getting questions, especially for those that see this on replay. But if there are any topics that interest you that you want me to cover during these every other Monday lives, just send me a message either through here or send me an email to officialdrrn@gmail.com. I'll write it here in the chat box, officialdrrn@gmail.com. And then I will cover that topic. So I don't know what I'm going to do next time yet. So if you have any ideas, just how I said, send me an email or write it in this comment box that stays open forever. I still get questions from my previous live where we talked about what other things you can do after you've been already an RN, which was about advanced practice nursing when you're getting your master's degree or your doctorate degree. And I'm still getting questions on that live, and that was 2 weeks ago. So, and that's fine because I answer all of your comments and your questions. So make sure you send me some topics that you want me to cover. Because I haven't thought about it yet. So this is the perfect opportunity. So we'll see what you send me, but I don't see any other questions. Let me see. Let me go back one more time. Let's see. All right, so I don't have any more questions. So thank you again for joining during our live on Dr. Registered Nurse. I'm going to be putting another content video later this week, either a Thursday or this weekend. We'll see. That's another opportunity that if you do have any topic suggestions, you can send them my way. I think I'm going to cover how to do a two-step BP, because I know that a lot of RNs and a lot of student nurses don't even know what I'm talking about. But that is super helpful to know how to do, especially when you have patients that have never visited ever a doctor's office or been in a hospital or have never received primary care. So how would you ask them, what's your normal blood pressure? They're not going to know that. So by knowing the two-step BP, you're going to be able to at least get some type of baseline for those type of patients. So I'm going to be doing that as my next video. All right. Well, I wish you a great rest of your night. Thank you for watching. Bye.